In my career as a psychiatrist, I've seen that mental health in general is complex, and our care models should actually accommodate that complexity. And what Being Health really addresses is looking at mental health as an interaction of both mind and body. We put all of those things under one roof to provide the best outcomes for the patient. Mental health care should not really be a one-size-fits-all solution. Treatment is often fragmented. And I wanted to put more tools in our toolkit. So we really are taking what a psychiatrist does, or even what a psychotherapist does in a traditional behavioral health clinic, and offering them a lot of options to refer to, but within the same system of care.
This model has more than just an intuitive sense of what's needed. It's a demonstration of what we can do as a profession in psychiatry. Being Health is a unique effort to bring a number of perspectives and professionals so that care is collaborative, coordinated, and comprehensive.
So in our system of care, we put all of those things under one roof to provide the best outcomes for the patient. First, we have psychiatry and psychotherapy. Second, we have novel treatments, the first of which is Ketamine Infusion Therapy. The third is functional medicine, and the fourth are wellness services, and we have two. One is acupuncture, and the second is nutrition from a functional medicine lens. We really wanted to humanize the way we talk about mental health, and so we have 4 categories that are publicly on our website in the way we talk about things. So anxiety, stress, depression, and trauma. And we've created a model of care called an integrated care model, where we're taking the 4 areas that I described and we're putting it all under one roof, both in person and virtually. Because usually all of those types of practitioners are not immediately collaborating within the same system of care, using the same EHR in integrated care rounds. And so in our model, it allows for increased provider collaboration, it allows for the potential for the patient to have one-stop shopping, and it allows this ease of having different services, but under one roof. So we're hoping to increase efficiency and improve the patient experience through our model of care.
We truly are an integrated team where we discuss new and complex cases, where we have presentations by each discipline, and where we really discuss new and cutting-edge research. Collaboration is something that is just ingrained in the care and in each individual member of our team here.
I think that psychiatry is at a transition point where increasingly there's a sense that if you don't respond to the standard treatments, that there are other treatments that you might still benefit from. We're not going to leave people behind suffering with mental illness, that we will provide the most effective possible treatments. Some of these treatments may include treatments such as ketamine.
What I love about our model of care is that we were able to plan for almost 2 years, and through expert reviews, through literature reviews, through going to conferences and really understanding best practices in this field, we created a ketamine protocol, and it was a collaboration by psychiatrists as well as expert anesthesiologists to create a gold standard of care. There is a 75-minute psychiatric evaluation. It's really important for us to look at risk. So we assess for psychiatric risk, substance use risk, and medical risk.
We always have a Being Health clinician in the room with patients throughout each and every ketamine infusion to make sure they feel safe and comfortable. So many of the new and emerging treatments really are reflective of the inherent connection between medicine, psychotherapy, and physical health.
We're positioning ourselves to be able to adopt novel treatments, such as psychedelic treatments, as they come on the market and become available to us. We're watching a lot of the clinical trials that are out there. So for example, there's 50+ clinical trials on psychedelics. Some of them I'm watching are LSD for anxiety, psilocybin for depression, MDMA for post-traumatic stress disorder.
I think mental health care needs a practice like Being Health because we're all recognizing outpatient mental health care needs a new approach. We need to think of the whole person when we're managing mental health crises and psychiatric illness. And I see in the plan for Being Health what I look at as mind-body medicine and whole person care that this could really improve outcomes for the patients who come through Being Health.
Mental health is part of health, but the mind and body is really connected. Our functional medicine program involves meeting with a functional medicine physician, as well as meeting with a functional nutritionist. So it really is a medicine, mind, body, and nutrition approach that is pretty comprehensive.
And what functional and integrative medicine aim to do is, number one, get at the root cause and the triggers that may be exacerbating the mental health conditions. And we do so by really looking at the mind and the body, by really understanding the patient's not just medical history, but their whole story. And then with that understanding, supporting the patient in a holistic manner.
Being Health has all of the, or many of the aspects, I should say, of how I think of holistic or integrated health. From the mental health perspectives, getting to have both therapists and psychiatrists available, and then having a nutritionist is absolutely crucial. Back in 400 BC, I think Hippocrates said, "Let food be thy medicine and your medicine be thy food."
Acupuncture can be a standalone treatment in our system of care, but also it can be added on as an adjunct. Clinical studies show that acupuncture can be helpful for anxiety, for pain, for depression, for menopausal symptoms, to reduce the severity of depression, to enhance the effect of antidepressants in terms of depression, and many more things.
Practices like Being Health are helping us to expand our understanding of mental well-being and mental health treatments to really treat the whole person.
We are an outpatient modern mental health clinic. Find us at beinghealth.co and book directly on our website. And if you're a referring provider who has a patient who might really benefit from a mind-body approach, we're a place that can help.